honor folks who are really heroes and dedicated to atopic dermatitis. Our inaugural RAD Award was given a couple of years ago, and it was Amy Powler was the recipient. So we solicited this year from the global audience through social media, through a website platform, from speakers, etc. And we had a number of folks who were nominated, but actually the person who received most nominations and who wins this year's Totally RAD Award is Korey Capozza from Global Parents of Eczema Research, and for her work as, not only as a caregiver, but in terms of contributions towards research in atopic dermatitis and eczema. Unfortunately, Korey wasn't able to be here in person, but I believe we have her on the line. But before we jump there, I just want to say, I've had the opportunity of working with Korey on a number of different research projects, and as someone with her, just has a tremendous insight and a passion for it, and obviously someone with a lived experience as a caregiver with a disease, and so that becomes irreplaceable motivator, but has truly been a hero for caregivers and advancing education and research, I should say, in dermatology, particularly to eczema. So, Korey, congratulations for being our second recipient for the We'll give you 2 seconds, more than 2 seconds, but just to be able to say a couple of words, and then we'll be able to turn it over to lunchtime.
Great, thank you so much, Dr. Silverberg, for that kind introduction and to the RAD meeting for this recognition. I know I am the only thing between you and lunch, so I will be very brief. But I'm really honored to receive this award, and just thought it was so cool when I heard that I would be receiving it, because I do live in coastal California, where Totally RAD is like the superlative compliment, so I'll be putting this on my wall. I also wanted to thank the dedicated board and staff of Global Parents for Eczema Research for really the engine and leaders of the work that we do. And just say that I've been involved with this conference for many years because I think we share a similar mission, which is to inform the eczema community with evidence-based information and research, with the ultimate goal of improving quality of life for people with AD and their families. And that mission was born out of my own struggle, as you mentioned, for what to do with my son, who as a toddler had severe eczema and seemed to perplex his providers, who noticed that he didn't seem to respond to anything we tried. And it was that experience of trying to navigate in the dark without evidence to guide us that led to Global Parents for Eczema Research and the work that we've done. We've collectively come so far since those early days, I think, and in the past 7 years we've seen a dizzying progress in science and treatments, mostly for adults available now, but coming soon for children, which we're so excited about. And these advancements in treatment have transformed lives, which we've been able to watch, and I've seen that happen for my own child as well, which has been a huge gift. And I think in the last 7 years, we've also changed how people think about AD or eczema. We've hosted a patient-focused drug development meeting to show policymakers and really the world the true impact of AD on patients and families. And we've published almost 24 studies on the burden and unmet needs that still urgently require our attention. So with this shared understanding, I think we're able to find solutions and move forward more quickly and have a more hopeful era for the children that we serve. But we still have work to do, and I just want to highlight 1 or 2 things maybe before you all move to lunch. One is that atopic dermatitis is a condition managed by patients and parents in their homes. It is a brief clinical visit that we have. Most of the care is happening in homes, and like many chronic conditions, it requires daily vigilance and complex management practices. And patients and caregivers thus must be partners in medical care to succeed, and they need self-management support. So I hope as we talk about revolutionizing atopic dermatitis, we think about that too. How to help patients and caregivers succeed with the treatments that they prefer and choose. They also need to be part of clinical practice guideline development. Their perspectives need to be included. And this isn't just philosophical, it's how we're going to improve care and outcomes for people with AD, as our own data have shown. And I just want to share finally that 3 days ago, a woman contacted me about her 18-month-old nephew. He was covered in eczema, head to toe, completely out of control, with a weepy, infected rash, it looked like. And these images are hard to look at because I know that's suffering. She asked, what can we do for him? And the truth is, we still only have partial answers. What is the best way to treat severe eczema in infants who have decades of life ahead of them and immature immune systems? We just talked about this in the previous session. How can we prevent progression to chronic lifelong AD and longer term sequelae, especially mental health impacts that can dramatically alter a life course? When should biologics and systemics be used in this age group and for how long? What causes AD to begin in the first place and to rage out of control? So I'll just leave by saying I think we really need to invest resources, energy, and talent in figuring out these critical questions, especially how to prevent moderate to severe eczema in children and to head off the suffering at the pass. So with that, thank you again for this honor and look forward to continuing to celebrate our successes and to work with all of you on the challenges ahead. Thank you, Dr. Silverberg.
Thank you, Korey. Next time, take the opportunity to thank and all patients in the audience and all of the patient organizations who out there around the world who have really worked instrumentally at advancing the cause for patients everywhere around the world. Thank you.